Hey everyone, I'm Kaylee. No, starting again. I'm Dr. Kaylee.
Oh yes, don't forget that.
Exactly.
Very important.
It's very important. Okay. Hey everyone, I'm Dr. Kaylee, also known as Kale's baby, and today I'm with the House of Medics and wanted to talk about sexual health testing. So I'm going to be doing a live test with you guys and talk through what's expected as well as when to test and how to test. So I've got the test kit with me here. Few things before we do the live test is when it is you should be testing and what the timelines are. So if you are screening for gonorrhea and chlamydia, it is 2 weeks after you've had sex. And if it's for syphilis and HIV, it's 4 weeks after you've had sex. So the swabs here for me today, let me just open this. It's gonna be a swab, like so, and a blood test, which is gonna go into here. So the swab is gonna be a vaginal swab, and if you're a guy, it would be a pee test as well. Or it can go in your urethra, so that your pee hole. You should be testing every 3 months if you are having regular sex, and if you've had unprotected sex with a new partner. So here we go, got my alcohol swab. We'll start with the blood first. So I like to use my ring finger, and it helps when your hands are warm as well. And if they're not warm, run them under some warm water beforehand, because you kind of have to milk the blood out. So this is the needle that you use. What you do is you just press firmly. There we go, to get a little bit of blood, and you just squeeze into the bottle. We've successfully got my blood sample for the HIV and syphilis screening, so that will be going away. And then now I'm gonna be doing the swab. So there's 3 different swabs that you can do for testing gonorrhea and chlamydia. It's a throat swab, a vaginal swab, and a rectal swab. On camera, I'll be doing the throat swab only, but I'll explain how you do the vaginal and rectal ones as well. So, hand mirror, throat swab. What I'm gonna do is open up the swab, and you wanna reach the back of your mouth in the top regions as well. So, sticking it open. And we put it in. So there we go. Oral swab collected. So then for the vaginal swab and rectal swab, again with clean hands, insert it into the vagina and rotate around 5 to 10 times. All good, done, put it away. And then, then you have your rectal swab, same thing. It goes into the back passage about 3 to 4 centimeters up, and give it a rotation 5 to 10 times, and you're all done. So that is in a nutshell how you test yourself. So let's talk, you've got a positive result. What are the next steps? What do you expect? I would say the first thing is don't panic. These things happen and it is very human. It's part of the process. It's important that we wear condoms and use protection and all of these things, but we are a service and we're here because this does happen. So things to expect is a text or a call to tell you that you've had your results back. You can log into the app and you'll see either positive or negative. And if you're positive, they'll give you a call and let you know, and then you can have treatments according to what it is. So most STDs are treatable, and the ones that aren't would be HIV. And with the medication for HIV these days, you can live a very normal life with the same lifespan as someone that does not have HIV. So when it comes to stigma and worrying, I think we all just need to normalize STDs. People get sick, and that's normal. People get STDs and that's normal. So let me, Dr. Kaylee, be the one to say, you are fine, and there's so many people that are like you that are going through this right now. So kind of laugh it off and be okay. It's gonna be okay. So the next thing after that would be knowing what the treatments are. So if you have symptoms and you have come into a sexual health center, you will likely be treated for those symptoms on the basis that it is pelvic inflammatory disease, and we will give the umbrella of antibiotics. So those would be oral antibiotics that you'd have to take, I believe it's for 2 weeks would be the longest that you'd be having it. And you would also get a stat dose injection in the bottom. So that injection is a one-off, and that would also be what you would have if you had gonorrhea. So if you have chlamydia, it would be just standard oral antibiotics. If it's gonorrhea, it's an injection in the bottom. And if it is lots of symptoms, so pelvic inflammatory disease, or the male equivalent is epididymitis, you would be getting the umbrella to protect you against kind of everything at the same time. So yeah, that would be what you'd expect. So I hope that you found my live demonstration and kind of intel of what to expect with STD screening helpful. If you have, please drop me a like or comment, and it'd be very much appreciated. Big love, Dr. Kaylee's baby. And thanks to the House of Medics for sponsoring this video.
Perfect. Well done.
Cool.
High five.
Yo, I did
Good.
it.
Good.
Yeah?
Really good. Yeah, you really